Hey, great presentation. Thank you
Well,
very
thank you,
much.
Bob.
Two questions. One is for your business model. You may have stated this, but are you positioning your business model for the 70% probability, the moderate probability?
I'm positioning it for between the moderate and the pessimistic. I'm anticipating 2025, so that to not, I tend to be too optimistic. So I tend to, I want to be that's my one of my biggest cognitive biases is excessive optimism. So I don't want to be too optimistic about this. So I'm making my 5-year plan right now, or no, that's not true. I'm revising my 5-year plan. I mean, of course I had one. So I'm revising my 5-year plan right now with my business partner to aim for early 2025 as the time that we have a vaccine. And of course, I can revise it, change the plans around if I have information that it's going to be later or earlier. So for example, recently, I think about 3 days ago, there was a new study that came out showing that the COVID-19 has more strains than we thought. Types of mutations. So there are 30 strains, and some of them are more deadly, some of them are less deadly. That indicates it will be harder to create a vaccine than we thought, because there's not like only a couple of strains. So you need to create a vaccine against a number of strains. So it's likely that the vaccines that are already in development will not address the, even half the strains. That means that they will unlikely to be effective. So that's an example of information that indicates to me that, yeah, we're not going to get there by early 2022.
Okay, I'm going to fire off two more questions real
Sure.
quick. One is, are your books available in audio format?
The Never Go With Your Gut, my primary one on business leadership, is available in audio format. I'll try to make the Resilience available in audio format.
Okay,
And
then
the Truth Seekers
we
Handbook.
know somebody that can do that for you if you need it. So
Excellent. Thank you.
and then last question, real quick: have you considered any military implications in all of your discussion and research?
Of course. I mean, if you look at what's happening in the U.S. military, a number of ships are getting hurt by and getting out of commission because of COVID-19. So you will definitely see some weakening of the U.S. Navy and its imperial presence. I'm not saying imperial in a bad way. I'm saying in a good way around the world.
Mm-hmm.
That's going to be one dynamic, that a number of the U.S. will be less able to extend its military reach. That means that there will be more global instability because the U.S. is a peacekeeper, one of the major world peacekeepers. So there will be more global instability. That's one. Second, in areas that already see global instability, I mean, you already see civil unrest rising in a number of African nations, India, a number of other countries that are having more civil unrest. So if your supply chains or the supply chains of your clients, to the extent that they depend on production and distribution from areas that are less stable, those areas will be even less stable. And there might be various forms of civil unrest, military conflict, of course, as a result of the pandemic.
Thank you very much.
You're welcome.
thank you. Who else? Anybody else want to make sure? Yeah, Kathleen.
Dr. Gleb, you are a force of nature. Thank you.
Thank you. I appreciate that.
Yeah, yes. And I hope that's okay, the informality here. Two questions for you. Number one, how are you monetizing your knowledge and your expertise on this COVID-19 situation? How are you monetizing it for your business?
So, of course, I'm doing webinars. This one I'm doing for free, of course, but a whole bunch of other webinars I'm doing paid. That's easy. Then I'm getting coaching and consulting from those webinars. Well, for some from the articles, but mainly the articles are leading to webinars. So that after a webinar, I'm getting consulting and coaching inquiries about, hey, you gave a great webinar. Now, how do I adapt it to my business? Come in and help me do this. So and then help me make a strategic plan on the long term. So that's the main way that I'm monetizing this. Of course, the book and so on, but the book will be, I mean, it will sell, it will be some money, but it's mainly a way of sharing the information and getting more potential clients.
Yes, great.
Name of the game, and that's what this whole group works on all the time. So it's a very similar group. Kelly Richards, you had a question, and then I'll go to Bob. You're on mute, Kelly. Thank you.
Apologies there. Hi, Gleb. Thank you so much for joining us. This has been invaluable information. I have two questions to ask, if I might. One is whether you have been approached or are approaching yourself to be in dialogue at the federal or state level to provide these insights, because I think you should be an advisor on this.
I really appreciate that. I have difficulties with being patient with some of the lack of competence shown by government officials. And that's one of the reasons I much prefer to work with business leaders who are much more decisive and much more, they have much more of their bottom line. They know where their bottom line is. And they know that, if I translate this into simple monetary terms, then we can have a very clear and simple conversation. Whereas if I go into politics, it depends on public opinion versus what's best for public health and what's best for the financial situation. And that makes me very frustrated because I really, no, sorry, no, you can hear me.
We understand that. We in California is where I am. We have, the governor is doing a yeoman's job of having put together an economic recovery council of the surviving governors in California and a whole slew of business leaders. Mm-hmm. And he's measuring all his decisions based on science and data. So excellent. I encourage you to think about California because we're kind of trying to make a leadership stance for the country.
If you have any connections and if the government indeed is looking at the science very strongly, please.
I do indeed. It's being co-chaired by Tom Steyer and Gavin Newsom, and I'd be happy to try to get you connected offline.
Perfect. Yeah, and you have the website tinyurl.com/the event, and we can put that in, and we'll talk offline.
Indeed.
Yeah,
indeed.
Kelly, I don't know if you have it, but I certainly do. Gavin's a friend of mine as well. I will send a link to this recording to Gavin's private email address.
Brilliant, Jeff.
That's wonderful. Yeah, I'll be happy. Yep, if a governor is indeed looking at the science, I'll be happy to.
He's a smart guy. He listens to a lot of different things, and this will be a private back channel, so I can just say, hey, this is something, Gavin, you should listen to. And he's that kind of guy.
That's perfect. That's what I was thinking too, Jeff. And my second question, if I might, Gleb, is to do with the recovery. Mm-hmm. I hate to say it, my intuition, informed by data, best we can get it, is that we're going to have a W-style recovery. But, this whole balance of health recovery in tandem with economic recovery. And my gut says, to your point about a couple of years before we have a perfect vaccine, that's probably true. But to the extent, even like the flu, we don't have, as you say, we don't have a perfect vaccine, but people still get the flu shot every year. Sure. And a certain percentage are better, and we keep going. Mm-hmm. I've heard rumors that, again, maybe overly optimistic, we could have that first vaccine that might help a certain percentage of the population as soon as this year's flu shot, maybe November, December timeframe. Very aggressive, I realize. Do you put any stock in that kind of a W cycle until we do get to that perfect vaccine a couple of years out?
What I've seen is that the most optimistic scenarios in vaccine development are not going to have any mass vaccination until the summer of 2021, and that's the start of mass vaccination. Now, what we can have before that is people at super high risk. So, for example, first responders, healthcare workers who are in the hospital and who don't have enough protective PPE, and it's more dangerous. It might be more dangerous for them to not have a vaccine than have a vaccine. So for those people to have, and who are actually healthcare experts and they know the dangers of this versus, Joe on the street who doesn't understand the dangers of this, realistically speaking, to have a vaccine. So that would be, something in the couple of 100,000 category. And now those would be sort of guinea pigs for the rest of us. That is not a mass vaccination program. That won't allow people to go back to work, unfortunately. So we'll have waves of restrictions and loosenings until we have a mass vaccination, which at the best case scenario can start taking place by summer 2021, and then would be half of the people, approximately the vulnerable categories, would be vaccinated by early 2022. That's the best case scenario that we realistically can have.
Understood. Thank you very much.
You're welcome.
I want to jump in because, I'm the chairman, so I get to do it. So let me ask a question. Then we'll go to Bob and then we'll go to Arjun. We're watching, I think there's going to be two kinds of people here, and you tell me how, and the neuroscience of this, so help me understand because I'm not that smart, but there's going to be one group of people that's ready to go around turning anyone in that walks within 3 feet of someone else. They're going to want to take a picture. And basically New York's actually encouraging this. Mm-hmm. And then there's this other side that are saying, forget the week, let's go back to work, right? And they're saying we can I actually saw a sign on the news that said sacrifice the week. Let's get back to work. I mean, I actually saw that. So, and there's that whole side of like, I don't give a shit. We're going back. We got to go do this. I mean, you see that. Tell me about how we deal with that. I mean, how do we walk that tightrope between those two, or do we? How do we speak to it? And then, because you got one state, Georgia's opening up right now. In South Dakota, where I'm living, we won't even see the peak of this thing until mid-June.
Yeah.
So how do you deal with that?
It's really tough. I saw a really interesting study which came out a couple of days ago, which talked about how people who listen to others, respond to the virus. So the study looked at Fox News, specifically two talk show hosts, Tucker Carlson, who was better than average Fox News host in terms of conveying information about this early, and Sean Hannity, who was worse than average Fox News host. So just conveying the information. Not saying about Fox News is bad or good, I'm just talking about those two show hosts, to be clear. Tucker Carlson early on said this is going to be serious, you really need to take care of yourself. Sean Hannity was dismissing it, saying it's not a problem. They looked at the viewership of those two shows, and they saw that compared to the average Fox News viewer, the viewers who were viewing Tucker Carlson had 3% less infection and deaths. And those who were listening and viewing Sean Hannity had 5% more infections and deaths. So that's just kind of the difference, purely difference of viewership of two shows, which were otherwise pretty ideologically similar. Tucker Carlson.
I hate to see Rush Limbaugh's listenership.
I have no idea. So that was just the study that came out, and I'm only looking at studies. So you'll see that people who are just ignoring things, going back to work, they'll be dying at a higher death rate, and they'll be killing grandma at a higher death rate. So and this is something that's very tragic for me, that my dad is pretty bad shape, but they will be killing loved ones. The firefighter's daughter that I mentioned, the firefighter, the guy's a firefighter, the woman is a police officer, their child, the 5-year-old kid died. It's in the news recently. And it's most likely that one of them gave it to her because they're first responders. They can't not be in the front lines, right? So this is a pretty terrible situation. And these are the people who go around and say, whatever, let's go back to work, let's do everything, who will get others killed and who will get themselves killed and who will get members of their family killed. So this is the kind of people that you want to be careful about, and you want to avoid, and you want to not spend too much time with them because they might be carriers without realizing it. They are putting you at risk. So you need to be figuring out how to deal with these people, because you, of course, need to interact with them. So this is something for you to figure out how to protect yourself. This is one of those when I talked about external stakeholders who are not addressing COVID-19 as nearly as seriously as it deserves to be, that's part of it. And this is something that you need to figure out how to deal with these folks. It's a hard thing to deal with.
Absolutely. Hey, Bob.
Yes, thank you very much, Gleb. Wonderful, wonderful presentation. First of all, I hope your father is doing well and he's going to recover.
I really hope so.
No, thank you very much. Two questions. One, leaders, when you talk to business leaders, it's this hunker down, save cash mentality. When we go talk to them, when I go talk to them and say, look, you need to reinvent your business, they're like, no, I just need to cut costs, And so how do you deal with that mentality, right? How do you deal with this mentality of fundamentally, you've got to reinvent your business? It's gone, it's dead, right? So that's the first thing. Instead of saying, I need to focus on cost control. Yes, you need to do that, but allocating money to reinvent your business. So that's the first question. The second one is more of financial markets. I mean, the stock market's up, right? I mean, it's down, but the stock market does not seem to reflect the reality of this pandemic. And so those are the two big questions about mentality of business leaders. How do you change those mentality to fundamentally transform in the stock market? Please, thank you.
Sure. So the stock market, unfortunately, is still focusing on the kind of input that Goldman Sachs gave, which is way too optimistic. So that's the stock market is simply, and Elon Musk, how he moves markets. Goldman Sachs moves markets, and they're moving markets in the wrong direction. The stock market is being way too optimistic about this. I think that the $50 billion for airlines will not be enough to tide them over in this period. You do not want to be holding an airline stock right now. A lot of people are buying airlines because they're like, oh, government won't let them go bankrupt. They're getting 50 billion. Well, I mean, 4 years of losing so much money, there'll be mergers, there'll be cuts. The stock market is being way too optimistic. Right now, I am shorting the stock market. So just FYI, that's just my personal perspective. Shorting the stock market, investing into stay-at-home stocks, Zoom, and so on. So that's stock market. Now, for business leaders, how I approach this question, and you're right, and a number of my clients are in that position, is that I guide them into cutting those areas that are going to be beneficial for them in the long term anyway. So I say, hey, totally right, totally understand your need to cut. What about giving up your office space right now? Selling it if you own it, most don't. Leasing it out. Having, if you need to have a conference, if you need to have a meeting, you can always use co-working spaces. How much does that save? I mean, that saves, for smaller companies, that saves 10,000 a month, right? Very small companies. For larger companies, it saves 100,000 a month. And of course, for really large companies, it saves $1 million a month. So that is an easy thing to cut. And then it forces them into the next steps, because then you cut that, and then you need to, of course, give support for your employees who are working at home. And so you need to fund some stuff, because if you don't support their cybersecurity, obviously it's going to cost you a lot of money. That's clear. That's crystal clear. And if you don't support their effective communication, they make mistakes, do professional development, that's crystal clear. So a lot of this stuff comes from making initial decisions that you help them make that lead to other decisions, healthy decisions, where initially you cut costs on things that they really shouldn't be spending money on, like office space. Cleaning office space, and I talk to them, if they still want to retain office space, I point out to them the liabilities, the legal liabilities they'll be facing, which a lot of my clients are going to be facing, where lawyers are hungry for business right now because a lot of their typical business dropped. And this is something that a lot of business leaders are not thinking about. They're thinking about, how do I get back to the office right now? And I'm telling them, do you really want to face the legal liabilities of this? No, you don't. So having that conversation, telling them, here are the areas you should be cutting, then leading from that into, hey, these are areas that are cut. Here are the areas that are going to cost you a lot of money if you don't invest into this. So that's the kind of conversation when a person is in a defensive position. So this is kind of the part of the emotional intelligence where we're talking about cognitive biases. They're in defensive position. They're only ready to hear defensive information. So you give them defensive information that would defend them from threats, let them cut costs, and then lead them out later as they get less defensive into reinvention. But first address their defensive nature, their defensive impulses.
Okay. Thank you.
You're welcome.
Very helpful.
Arjun.
We really truly appreciate, because many a time we don't know what we don't know. This was like a huge enlightenment for us. So 2 follow-up questions. One is for all of us to at least look for the last 5 to 6 weeks to agree. We need to agree on common numbers. The very fact even simple numbers of ratios are being calculated based on denominator and numerator, both unknown. What are KPIs, numbers you're looking at to see whether it's going on optimistic or which direction? Mm-hmm. And secondly, based on the work, have you looked at what industries are going to thrive most? So that way, yes, for most of us, we can start learning from you on where to go forward. Again, yes, thank you really for everything you're sharing.
You're very welcome. So the KPIs, what you're going to be looking for, the main thing that's going to lead us out of this is going to be vaccine. You don't want to look for, triumphalist vaccine studies from the vaccine manufacturers saying, yay, our vaccine is approved. What it means that their vaccine is approved often means that the vaccine is approved for human trials. And human trials, most vaccines don't make it for human trials. So you want to be very careful about that. A good person to look at in terms of this information is experts who don't have a stake in which vaccine makes it through, but who are experts in vaccines. From a business perspective, Bill Gates is actually a really good voice on this. So if you want to follow someone who is really thinking about the economy and more broadly, he's someone who is a good voice on this. So the Bill Melinda Gates Foundation, in a nonprofit way, they don't get any stakes. They're funding a lot of vaccines, again, giving them grants, pure grants, and they are very much interested in getting a vaccine out as quickly as possible. So he's saying, for example, he himself knows that 18 months is the earliest we can have for a realistic mass vaccination program. He's also saying, just like I am, that most vaccines will fail. So this is, stuff from him. You can, of course, look at the expert researchers who are talking about, hey, this is when, who don't have a stake in the game, this is when we expect vaccines to be available. Vaccines are the most important thing in this case, unfortunately. So that's kind of what I would talk about in terms of what kind of things you want to look at for seeing the timeline, because that's the only way that we're really going to get out of this. That's one. For industries, of course, tech is going to be pretty good, especially the techs that are dependent, that are facilitate people staying at home. Everything from, we've heard Amazon, Zoom, a lot of video conference companies that are going to be doing well right now. Companies that provide people with activities to do at home are going to do well. So gardening companies. Something that you might not be thinking about, but that you want to explore is that, as right now, people are going to do a lot of gardening, right? But in the winter, people are going to want to do DIY projects in their homes. So things like Home Depot, things like these areas, things where people are provided with services and occupations that they can do at home, various entertainment options. So things that various streaming services. So a lot of technology stocks are going to do well. Financial stocks are going to do well. They're going to be hit early onward with a lot of companies going bankrupt, but overall they will make it out through this pretty well, partially because the government is funneling money through them and they're taking a cut of the money, regardless of whether they should or not. They are taking a cut of this money, and they are going to do pretty well in part because of this. So finance, people are going to be thinking about in terms of insurance. Insurance companies are going to do well in this. So these are the kinds of companies that are going to do well in this. Direct-to-retailer companies, so manufacturing companies, branding companies that are direct-to-retailer are going to do well as well. So those are companies that are going to be pretty successful in this marketplace. You don't want to get involved, of course, healthcare companies. I mean, this is clear. After an initial period where elective surgeries are going to be not allowed, they'll lose some money, hospitals, but overall, healthcare is going to go up. People will be much more concerned about their health. This is an undoubtable consequence of this pandemic, so people will be much more focused on their health than they have been. So exercise companies, everything from exercise to mental well-being to direct taking care of people, medtech companies, all of these companies are going to be doing well. Companies that aren't going to be doing well are real estate. So a lot of real estate companies are not going to be doing well. Agriculture will take a while to adapt to this new situation. So a lot of companies that you might think are going to do well are not going to be doing nearly as well. And a lot of companies, mining and so on, are not going to be doing as well, partially because when you have a breakout of COVID-19 in, let's say, the workers of a mine, then it's going to spread pretty quickly among them. And remember that about half the people who have COVID-19 are asymptomatic. So there'll be lots of shutdowns, lots of closures. So manufacturing companies are going to be in a difficult position. I say this, it's hard for me to say this because a lot of my clients are in the Midwest in Columbus, Ohio. So a lot of my company's clients are manufacturing, but they're going to have a hard time. They're struggling. So this is something that you want to be careful about, that sector. I hope that's helpful.
A very important part. James, you got a question?
Yeah, I've got a question, and thanks again. I mean, this is amazing.
You're welcome, James.
Can you hear me?
Yes.
Yep.
Okay. So yeah, my question is, you mentioned how we need to plan for the future, 4 or 5 year out plan.
Yes.
And you had mentioned also pivoting now.
Yes.
So in the pivoting now to adjust for the new abnormal versus pivoting or preparing for the 4 to 5 years from now, what's more important? How do you tie the two together? Do you expect it to be a completely different view after the recovery in 4 to 5 years? Is there a flow to tie them together, or should we be looking at a now versus later, or is it just changing now in a way that gets us to that?
Yes, so it's the last. So you want to paint a clear vision of the future. There are a variety. Look at the optimistic scenario, the moderate scenario, and the pessimistic scenario. What will your business look like in 5 years in the optimistic scenario? That means 2-year, early 2022 vaccine, then of course society will be changed habits, norms. How will your business evolve over that 5 years? That's the optimistic scenario. Do the same thing for the moderate scenario. 5 years out, what will happen if a vaccine is available by early 2024? How will your business be impacted? What will be the dynamics, will be the transformation? Then the pessimistic scenario. If 2025 passes, it doesn't look like we're having a vaccine. So what does your business look like in that situation? All of those 3 situations. Look at what your business looks like, and then what kind of problems might arise in each of these situations for your business. Think about how you can solve these problems in advance right now, or how you can make a plan at least to address these problems. Invest resources into addressing these problems now. Think about what kind of opportunities might arise for your business, and of course for the client, for your clients, all of that stuff. This is information you're conveying to your clients, right? So think about what kind of opportunities might arise for them and for you, and how you can right now take advantage of these opportunities that might arise. Some of them you can create, some of them you can plan for, depending on the opportunity. And then think about what information would lead you to believe you're in each of these scenarios. I talked about the research on vaccines as being one of them. Be careful about spin conveyed by politicians about various things. As you can tell, I don't have too high of a regard for politicians. Gavin Newsom might be different, but you want to look at people who are actually doing the science, doing the research, or people who don't have a stake in the game, like Bill Gates. There are a number of other really prominent people who don't have a direct stake, Warren Buffett and so on, who are looking at the situation very closely and doing good analysis of the situation. So that's the kind of approach I would recommend you to take. So look at those scenarios, see what your business would look like, and how then plan for the moderate pessimistic scenario. I'm telling you, I'm playing for early 2025 vaccine available, and then what you would need to do to get there successfully. Your most ideal vision of the future at early 2025, all problems solved, all opportunities seized. What can you do right now to get there? So pivot your business right now to get to that point, and then adjust, execute, adjust as you get more information about vaccine and other relevant factors going forward. That would be my best advice for what you can do right now. But the doing right now means figuring out the plan first. Start from the end out and go toward the now. So start from the end and go toward the present.
Imagine one of the things you're probably going to see Trump do. I can tell you already what's going to happen. He's going to, right before the election, sometime in August, he's going to point back to this, and he's going to talk about the Chinese virus. He's already been throwing it out there, and he's testing it. That's what he does. He throws stuff out and says, does it stick? Does it stick? Does it stick? Well, with his base, it sticks. And one of the things he's going to do to use this piece of it is to say, we put all of our faith in China. We got 34% of our GDP over there. We got, 27% of our GDP, 17% worldwide. In some other countries, it's even higher. Why are we putting all those plants over there? We've screwed ourselves. We don't want to be reluctant. We don't want to depend on this Chinese virus, Chinese supplies. Look what they did to our country. We need to bring it back to America. And so or to bring it closer to home. So he's going to do that as well. It's going to be interesting to see how the message is going to take off on this piece of it as well with the manufacturing. Mark, you got another question?
Yeah, I really appreciate this. This has really put a ton of flesh on some of the bones and some of the thoughts that I've had. Some of the things that I'm telling people is there isn't going to be a new normal. There's going to be a series of ever-changing new normal, which means that instead of making a plan, you need to build a competence for adjustment. Mm-hmm. Because that's going to be the distinguishing characteristics and your competitive advantage is your ability to listen to your clients, figure out how your value has changed, because everybody's value has changed and is going to continue to change. And it's either your value has changed or how you deliver it has got to change in some combination. So, man, do I appreciate your putting a ton of flesh on those bones.
You're very welcome, Mark. I'm glad that this was helpful. And definitely you want to give people confidence about their competence and ability to be resilient in this situation. This is incredibly important. At the same time, you want to encourage them to make plans for a variety of scenarios. So what can happen in this scenario, this scenario, this scenario, and how can you go forward with that? So that a combination of resilience, adaptability, and vision of potential futures.
Okay, Tina, one more, because we've already held them longer than we expected.
I have a burning question. When can I see my grandson?
That's a great question. I mean, depending on the situation, is your grandson near you?
No, he's in Denver and I'm in San Francisco.
I would say not for the next 3 months. I mean, you can see him on Zoom, but not for the next 3 months. This is not something you want to mess around with flights if you can help it. So
it's it's interesting how it's changing the family dynamics too. Quite frankly, there's some positives without question. Think about this. One of the greatest positives I'm seeing is actually families are getting together and doing game nights, even virtually.
Yep.
They're having more group calls. My family's never had a group call. We're now doing them every single week and with different family groups. And, you know, it could be good or bad depending on what you think about that. But let's just assume it's a good thing, right? So you're actually seeing some different things. It also is causing us, I just give you my own personal thing, you know, as many of you know, Todd, you might see Todd walk in here. Todd's got cognitive disabilities, which he operates, he's 2 years younger than I am, but he operates at like a 12-year-old. But we've had huge difficulties with him because he's autistic. So he has his own routine, the way he does it. And so we've had to break that routine, and he wants to just go home. Well, he's also got poor functioning kidneys. If he gets this thing, he's dead. He's absolutely dead. And so we're having to battle with that and battle him and to understand what is this and why. So I will tell you, for the first week, he hated me because first thing I did was, Tammy, you got to go pick up Todd. You got to bring him home. You have to bring him home right now because this is going to be that bad. We have to go get him. We have to bring him home. We have to keep him away from everybody. So, but he thought I was trying to restrict him. So he's hated me because I'm the one to blame because he can't go anywhere. Right. But it's a whole different kind of thing that you have to like weigh into the situation. And by the way, we've had to tell him he wants to go see another relative. Well, if you go, you're never coming back here for the next 4 months. You're not coming back because you can't go out and then expose yourself and then come back. I can't have you ping-ponging because, as most of us know, the business really depends on all of us everyone in this entire square. We go down, the business goes down. And so, you know, even to the point where I'm having to deal with feelings, guess who goes out and has to get the groceries and things like that? Tammy does, not me. And of course I would be the one, first of all, well, I have to go do that. But for God's sakes, we're trying to protect me because the bread and butter, the eye candy that we all have, it's a tough thing to deal with some days, right? So just a point that we have to think through sometimes.
That's a good point. That's a very important point. And you have to protect yourself in this situation. You know, if you can, obviously get grocery delivery and so on. Yes, you have to protect yourself and not let your members of your household go out if you can absolutely help it. So this is
and Dr. Gleb, I want to thank you again for everything today. What a great presentation.